Staying connected during the holidays. For me, I love holidays, but for some people, it's a very difficult time. The world has changed a lot, and technology, it's good and it's bad. Some people say it's our demise. Some people say it's our savior. So we're going to actually learn how to use this better, especially during this time of the season. And I can't think of a better person than Sonia, who's taught me so much over the years. So Sonia, take it away.
Perfect. Thanks so much, Dr. Curnew. So yeah, as Dr. Curnew mentioned, today is all about how to stay connected virtually, especially given that the holiday season is right around the corner. So in today's webinar, we've got a few bits of information to share with you. So we're going to start off by going through some video conferencing tips and tricks, especially Zoom, which you can use to stay connected with your loved ones, as well as with us here at the clinic. We're also going to touch on Facebook and YouTube. We're going to give you a bit of a refresher on our amazing clinic website and also some of the support groups we have running weekly, and then end off with some general holiday health tips and reminders for everyone. So before we start off, as Dr. Curnew mentioned, I'm part of the Health Technology Club, and our whole purpose really is to highlight some of the benefits and sometimes the downsides of using technology to improve our health. And so oftentimes patients will also ask, well, what role does technology actually play in our health? And so the first thing that technology can do for us is really help us enhance kind of our social network and help us find support, especially virtually when in person is not possible. So research has shown that connecting via social media and using technology in that way has actually reduced a lot of loneliness and depression and has overall increased a lot of life satisfaction. And I can't personally think of a better example regarding this other than the COVID pandemic that a lot of us of course went through, where we were isolated and there were a lot of restrictions on meeting our loved ones in person, and that's when we saw a peak in people using social media sites and Zoom, which we're using today, to stay connected with those around them. So it's a really great way to kind of reduce some of that isolation that we might experience during difficult times. The second thing that technology can do for us is really help us and help our progress towards our healthcare goals. And the way that it can do this is quite varied. So first of all, it can help us stay informed on our health reports. So oftentimes, the doctor will tell us to get blood work done. Well, what are the results of those blood works and how do we actually access that information? That's how using websites like Life Labs comes in and how you can actually keep track of your own information through that way. And
So
secondly,
one of the interesting things about blood results, it's been hard getting blood work sheets to people right now. So we have different ways of doing that. And so if you have a requisition form that you have from us, each requisition form it has a date, has an expiry date 6 months afterwards. So that's why we often don't put dates on them. We often give multiple copies. Some of you will make extra copies and we'll discuss what's available. There's going to be ways with Medjos to distribute them. And then you get those from your family doctors. So really be attentive that we want you, we often give you at least try to have 2 copies and have an extra copy available, and discuss with us whether or not you should make copies of these things too as well. Really important to actually to get blood work, you need to have a requisition form. So make sure you understand what we're doing. I think with the pandemic, I'm actually trying to give blood work a little bit more often. For many people, if you have diabetes, we often traditionally get them every 3 months. But with the pandemic, if you're well controlled, maybe we'll just change it to every 4 months. For many people, I'm now getting them every 4 months in this coming year, and we often try to give you 2 of them. Now, once you get the requisition forms, that's step one. Number two is how do you get results? Traditionally, you get them when you're in the clinic. Our technology does not allow you to email your results at this stage. So if you want results, you have to be in the clinic when your appointment, or you're going to show us how you get that online. So please tell us more.
Exactly, yeah, and there's lots of ways you can actually access your results online, especially if you go to a Life Labs clinic near your home. You can actually log into the Life Labs website, create an account on that website, and be able to see your entire lab report online. And that will make you better prepared for when you go into clinic with Dr. Curnew, and you can come prepared with your questions or really already have a primer as to what that blood work shown. The second way that technology can really help is to keep track of our progress towards our goals. So we have a lot of apps, a lot of online blogs, a lot of tutorials and support groups that are made to help you towards your goals, no matter what they are, whether it's weight loss or sugar control or exercise. There's a ton and tons of resources that are available for you. So before we kind of
So,
dive
so,
into all of that,
so you guys remember that you can get your so the two big labs are Life Labs and Dynacare. Both
mhm,
systems allow you to get them available. Dynacare charges you a small fee. Life Lab doesn't charge you a fee, but knowing your results and keeping track of that is a wonderful, very powerful tool. So we have a
mhm,
couple of videos that you create on that. Take a look
yeah.
at them, and maybe at some point in time, Daniel can actually show what they look like and how to find them if you want to. Um, it's important that you have now control over your lab results. And now the hospitals often have their own systems that they allow you to as well. So this is now becoming more of a standard of way we do things. So I like this thing about growth mindsets or fixed mindsets. So the fixed mindset is the doctor will take care of me. I don't really give a darn. The doctor will tell me. The growth mindset, I want to understand what's going on. I like the growth
Mhm.
mindset. So tell us more about these sorts of thoughts here.
Exactly. So essentially, what Dr. Curnew said, the growth mindset is really approaching your health and also, technology as an opportunity to grow and to learn from it. Whereas a fixed mindset, you think about all these different tools and resources that are out there, and instead you're kind of daunted by them, and immediately, you jump to conclusions and say, well, I won't be good at this, or it's too frustrating. I'm just not going to try. So really here we're encouraging you as you watch this webinar and as you move forward with some of the tips that we share, that you kind of adopt a growth mindset, and hopefully we can share some great resources for you to learn how. So the first thing we're gonna go over is Zoom, and the reason we're going over this today is really it's a great video conferencing tool to help you log into webinars, such as the one we have here at our clinic right now, as well as to stay connected with your family and friends if you choose to use it for that, and also to log into any other webinars or support groups that happen externally as well. So this is what Zoom looks like in terms of its logo. And to log into Zoom, you would essentially Google Zoom, and this is the direct link as well that we can link afterwards. And this is kind of what the home page of Zoom looks like. So you have a couple of options when you're trying to join a meeting on Zoom. So if you've already been shared the meeting information, either from the clinic, from your friends or family, or elsewhere, on the top right-hand corner, there is a small tab that says Join a Meeting, which is circled in red here. And when you do this, it will ask you to enter in the meeting ID or the personal link name. And that should be provided to you. For example, we provide that in our clinic newsletters, which I'll show you in just a second, or it could be provided to you by whoever the meeting host is. So you want to copy and paste that into this box here and click join. So for example, here I've attached a screenshot of someone who might be sending you a Zoom link, and you can see at the bottom there, it shows the meeting ID as well as the password. So you can click on the Zoom link directly or enter those digits of numbers into that dialog box. After you enter in the meeting ID, this kind of screen will show up. And essentially, this is where Zoom is going to launch the platform, and you can go ahead and click Open Zoom. And the software will ask you whether you want to join by phone call or by computer audio. And this is really great to know because sometimes you're on the go and maybe don't have access to a laptop or a computer. You're actually able to click the phone call tab and join in by dialing in a number. But in this example, we'll show you with computer audio, you can simply click Join with computer audio, and you'll be entered into what we call the Zoom room. So it's a bit daunting at first. There's lots of different panels and buttons and features. So we'll kind of break it down and go through them one by one. So in the context of our webinars, for example, you can mute or unmute your microphone, which you see here on the bottom left. Zoom has the option to either show your video or you can turn your video off during meetings by simply toggling that button. And there's the panels at the bottom will really give you a couple of different options. So you have options to see the participants that are in the meeting. You have options to open the chat box where you can type in whatever you want and talk to the different participants in the meeting itself. You can share your screen, which is what I'm doing right now to share the slideshow. You can record meetings and you can also end the meeting as well, which is on the bottom right-hand corner. So for our webinars, we ask that when people are presenting that you have your mic off. And when you have your mic off, that's kind of what the button will look like. It'll be red. But we, of course, want to hear your thoughts and opinions. So if you're joining us live, feel free to unmute and ask questions or share stories and whatever it is that you want to contribute to our chats. You can also start your video during our webinars. We'd love to see your face and put a name to a face, so you can do that as well. And if you ever have questions, you can type it in the chat and we'll try to address it as we go on with whatever we're talking about. Now, in terms of how to log into our webinars, we send newsletters every week, usually twice a week. The first being to share the weekly videos that we release on YouTube, which I'll chat about in just a minute. And the second is usually a link to the live stream webinar. And we usually include a image that shows the title of the webinar, a little description so you know what we're going to talk about, and then finally, we give you the option to join on Zoom or on YouTube. So you'll notice here that we actually include the meeting ID, or you can click the link directly to join us as well. So that is basically Zoom for you, and we hope that helps you join our live stream webinars. And if you have any questions or ever have any trouble joining our webinars, please let us know, and we'd be happy to help fix that on your end. The second thing we'll kind of chat about is social media and YouTube. So one of the most common social media sites that you may have heard of is, of course, Facebook. And Facebook is great because it lets you not only stay connected with your loved ones, like your family and friends, but we also actually use Facebook a lot in our clinic to have different support groups running and the clinic page as well, which will share a lot of the videos and webinars that we host. So to go through how to make a Facebook account, essentially you want to go onto facebook.com and there'll be a button that's green at the bottom that says create new account. So you can go ahead and click that. And the sign up is fairly simple. It usually takes a few minutes, but essentially you enter in your information. So Facebook will ask you for your name, your number, you want to create a password. And this is a general tech tip. A lot of websites will ask you to kind of create a password. So it's helpful to have these passwords either written down somewhere safe or to use a password that you'll for sure remember. There are options, of course, afterwards to click the forget my password button and get that reset. But I do like to remind everyone of this just so that they choose something that's familiar to them. And once you've entered your information in, you can click sign up at the bottom. And you should receive an email asking you to confirm your account. So do note that you need an email address that's working and active for this. And once you do that, your account will basically be activated. And so we actually have a page for the clinic. So to find the page, you can go into the search bar and search up the life group. And you'll be able to see this logo and banner. And what you want to do is click like on the page so that you're able to see all of the updates that are coming in. So I've kind of shown examples of that here. And the search bar on Facebook is usually at the top, and the like button you'll see kind of next to the Facebook page itself. So usually on our Facebook, we like to post a lot about the videos and webinars that we're hosting. So if you don't check your email often or are on Facebook more, you're welcome to kind of attend those through YouTube or Zoom directly through Facebook. The cool thing about Facebook as well is it gives you a lot of options to interact with us as well. So, for example, you can comment your thoughts or opinions on the different webinars. You can also share the link directly to other Facebook friends or family that you have through the share button that's on the bottom right-hand corner of each post. And it's a really great way for you to even save videos for future use as well. So a lot of folks find Facebook a bit more user friendly and people check it a little bit more than email sometimes. So you have a lot of options there in terms of how you want to stay connected, not only with us, but also with the rest of your loved ones. And so I've mentioned quite a bit about YouTube along with our Zoom option. So I just wanted to take a second here to show you how to actually navigate our YouTube channel, because that's one of the ways in which we share a lot of the videos that we have and our webinars. You can join live on Zoom, but you can also watch live on YouTube. So it's great to know the different options that you have. So in terms of our when our videos are being released, so normally we have the videos being released on Wednesdays, which will be sent through the newsletters. I believe now this has been changed to Mondays. Daniel, correct me if I'm wrong. And the webinars are going to be happening Thursday evening, not Friday evening. So I'll change the slide afterwards. But essentially, if you are on top of your email, we'll send you a lot of reminders of when the videos have been released, which includes sort of the photo as well as the link to access them. And then we'll also send you the link to the Zoom webinars that happen every week. And they usually happen around the evening time, and sometimes the times can change. So just keep an eye out on your email for that. And of course, the videos and every video and webinar that we do is recorded and it's available for you to watch afterwards as well. So on the YouTube page, if you haven't used YouTube before, there is a search bar at the top. And essentially, one way to find our YouTube channel is to simply type in Dr. Curnew's name in the search bar, and you'll be able to see an image at the top that has a photo of Dr. Curnew and a little description. So you can go ahead and click that, and it will take you directly to our YouTube channel. Now, on this YouTube channel, you'll see a few different tabs. So at the top, we've got the videos tab, playlists, channels, and then discussion. So if you go ahead and click the videos tab, you'll be able to see the videos that we have sort of in most recent to least recent. And just so you know, we have videos on practically every health topic that you can think of. They're very comprehensive. The videos that are released every week, we try to make them short and sweet. So they're usually, 8 to 10 minutes. The videos have improved a lot over time. We have a lot of animations that we add, and a lot of our volunteers work really, really hard to make these videos for you. And they're also made directly by the questions that we get asked in clinic by a lot of the patients. So they're informative and they're there to address your needs. So you can see some examples here, of course. And when you look at the videos page, you'll also be able to see the title of the video as well as how long it is. And when you actually click on the video itself, you should be able to see a little description about it as well. So it's very, very user-friendly and a great way for you to get a quick 10-minute new information for the day. I also wanted to go through the playlist tab on our YouTube channel because a lot of patients find this helpful too, because essentially the way we organize our clinic is we've got different groups working on different topics or themes regarding health. So for example, we've got an exercise club, medications club, a sugar club. So we've actually organized a lot of the videos and resources by those groups too. So if you are having a goal to improve your physical activity and exercise, you can find the exercise club playlist, and that way all the videos that you see will be related to that. So it's a really neat way for you to kind of easily get to what you want. And of course, if you have any feedback on how we organize our YouTube channel, we'd of course welcome that. And we're always looking for ways to improve it as well. And the last thing I wanted to show you was topic-specific searches. So the search bar in YouTube, you can also do by channel. So here I've shown the search bar, and let's say you are, Dr. Curnew has just told you recently that you've got high cholesterol, you go home and you want to learn more. Well, lucky enough for you, you can actually type in keywords into the search bar. So let's say you type in cholesterol, and all the videos related to cholesterol that we have will pop up. So you can see here examples of videos talking about medications like statins, or how to manage high cholesterol. So that's a really helpful way for you to easily and quickly find exactly what you're looking for. So I have a couple of different examples here with hypertension, as well as diabetes, which our Sugar Club does a fantastic job on as well. So there's tons and tons of resources, and the question is whether you will use them and how you will use them to really improve your own health day by day. And of course, again, some of the other feature videos here, we've also got a lot of information on meditation, building resilience, sort of, how to be in tune with your own emotions as well. And then looking at different things like exercise and overall heart health too. So a lot to learn. The next thing I wanted to go over was the clinic website and kind of give you a tutorial on that. So you may have heard in some of the past webinars over the last few months that we do have a new website. It's been upgraded and it's very user-friendly and it's really been made for you. There's lots of resources on there that I wanted to walk you through that are going to help you reach your health goals. So I actually have the website up right now, and the website link is drcurnewhealth.com. So when you type that in, this is the home page that you're going to see. So as you scroll to the bottom, you'll be able to see some of the latest clinic news. So for example, different events that are happening, such as when Dr. Curnew and the rest of the crew go out to do stairs, different fundraisers that are going on, different initiatives that are happening. So it's a great way for you to stay in touch with us. And we've also featured some of our other videos at the homepage as well. You can also see the direct link to our YouTube page. So I walked you through how to get there directly, but you can also go onto our website and access that. And then our support groups, which I'll go over in a second as well. And on the top right-hand corner, we've also got a few different tabs. So the first one is on appointment, frequently asked questions, and information. So this is basically an area for you to learn how to prepare best for your appointments. So, for example, making sure you're masked, how to check in at our front desk and talk to volunteers. And then what's really great here is we have a commonly asked questions section at the bottom here. So these are questions that we've gotten over and over from our patients. And if you are wondering about these same things, you can simply click on the question you're wondering about, and there's tons of answers for you. So it's great if you ever have a question and want to get an easy access. There's also a resources tab here, which goes through the YouTube, the focus groups, and medications. So I'll just show you an example of the medications tab here. So there's a lot of different medications that you may be on already or that Dr. Curnew mentions. We understand it can be overwhelming to hear all of it at once. So we've broken them down for you by different classes. We've listed the different names and what they're used for. So it's a great resource for you to be able to access after your appointments as well. And then of course, our focus groups, which I'll highlight in just a second. We've got a weekly schedule and tons of groups going on. So this is a great way, especially during the holiday season when things can get stressful and chaotic, to keep yourself accountable to your health goals and to find other people who are also working towards the same goals as you. So that is a little bit of a tutorial on our website. And I just wanted to highlight some of the groups that we have now. So like I mentioned, and I showed you, the way to actually sign up for the focus groups is through the website with the sign up link that we have, but I'll highlight some of them here. So The first focus group that we have, of course, is on weight loss. So this group is really active. They even have a Facebook page going where a lot of patients will sort of share their journey, share tips and tricks that have helped them in the past and also currently to manage their weight. This group calls weekly as well on Zoom, and it's a great way for you to learn some tips and also to stay connected with others who are working towards this goal. We also have one for mindfulness and meditation on Wednesday nights. This is a more focused group as part of the Sugar Club on how to lose 30 pounds in 30 weeks. So a lot on resiliency, healthy eating, and habit formation, which if you think about it, doing by yourself can be quite daunting and challenging. So having a group that can work towards these goals with you makes life that much easier. There's also the Sugar Club that meets on the weekends once a month, really trying to, ask questions about your diabetes, for example, and also having volunteers and Dr. Curnew check up on your goals with you and follow up. Also for folks who are working towards quitting smoking, having a safe space where you're able to talk through about that journey, about different things that have helped in the past and are helping right now. And we've got Sunday dinners, which are starting up again. A great way, again, especially during the holiday season, for you to not only learn about healthy eating, but to have a good group of individuals who you can enjoy some dinner with. And then, of course, plant-based dieting as well. So tons and tons of groups. And if you haven't checked them out already, the holiday season is a really great time to do that, especially as the new year rolls around and folks start to have New Year's resolutions. It's great to find a community that is willing to invest time and energy and resources in you, and also just kind of share your journey with other people, which a lot of patients also find helpful. So the last section here is on general holiday health tips. So the first thing we wanted to go over here was about prescription refills. It's a very common thing that a lot of patients kind of have to go through. So for shoppers, they actually have a really neat and convenient way to refill your prescriptions online. And the way to do this is to go onto their website. So you can go onto mypharmacy.shoppersdrugmart.com. In the top left-hand corner, you'll notice a tab that says prescriptions, and you can click on that to start the process. So if you don't already have an account with Shoppers, you can first create an account, which can be found on the top right-hand corner. So this will include your email and your password, and then you can go ahead and sign in with that account information once it's created. And you might be wondering, well, what are the benefits of doing all this online when I can just, come in and do the same thing? Well, the cool thing about this is that it actually has an auto refill function. So it can refill prescriptions automatically depending on the timing, especially when you're busy and aren't able to actually do it yourself. You can manage family members on it as well. And I'll walk you through that in a second, how to do it. But you can link different family members to your account, and they can also help support you in your medications refill. And it's really just fast and efficient. So everything is in one place. Doing your request refills online, a lot of people find a lot more convenient, and it just makes things a lot quicker. So like I mentioned, you can sign up and you can turn on autofill. So once you sign in, and if you use Shoppers, it'll essentially give you, it'll have access to all the prescriptions you're on. So you can choose which prescriptions you would like to be automatically refilled. So if you know this prescription you're going to be taking for a while, you can click the auto refill on for that. You can control the settings for each prescription, so how often you think you'll be needing the refill, and you're always welcome to cancel that service anytime that you want. Shoppers will also give you pickup reminders. So once that prescription has been refilled and it's ready to go, they will actually either text you or email you when it's ready to be picked up. And you can see an example of that here. And again, very fast and convenient because you get to skip the line. It'll be ready at the pickup counter, and you can just pay for it and be on your way. Now, I mentioned here that you can manage family members on the auto refill as well. So, like I said, once you sign up and create your account, there is an option on the website to add your family members. So they can be added in and receive the same information that you've inputted and actually get access to your account. And so, you can actually click auto refill for all your family members and pick up medications for everyone at the same time, which again saves a lot of time for folks. So with that, oh, go ahead, Dr. Curnew.
Well, it's kind of interesting what you're saying about that. So each pharmacist has their own system.
Mhm,
The problem is that's just what the pharmacy has. Your family doctor might have something different.
mhm,
Your list may show something different. The hospital may show something different. And when you say you get automatically get refills, that someone has to write the prescription. And we know that the weakest part of any electronic system is medications. Most of them are
mhm,
wrong. And when the person says to me, nothing's changed, you should know. The answer is, I don't most of the time. And we know that around 50% of people will stop or modify their medications at some point in time. Sometimes the pharmacy will know, sometimes will not. We are trying to make a system that's all encompassing. So we actually did approach shoppers and say, can we actually have an open source system where they all blend together? The answer is that they didn't want to do it. And Rexall doesn't want to do it. Other people don't want to do it. But to me is that we need to have one place where all your medications are. Um, they have to correspond to what your doctor have. I'm one of the doctors. Many people have 2 to 6 doctors, and they all have separate systems. So we're all working not together but separately. So I think medical errors are a big problem. They cause many issues, and so I think people have to take on responsibilities to be part of the solution. Right now, most people are part of the problem. They don't know what they're taking and why they're taking it.
mhm,
You mentioned we have some resources to explain medications. Uh, you should, in your wallet, purse, back pocket, wherever you keep your things, you should have a complete up-to-date medication list that's available that you can change and update. Very few people have this. And so during the pandemic, we renewed a lot of prescriptions, but is that I don't want to spend time renewing prescriptions if you're not in front of me, because I want to make sure you're on the right medications. And if you just backtrack, one of the slides there is that I want to renew all your prescriptions for a full year if I can, simultaneously. Now, I find that most pharmacists will renew one prescription at a time. They won't put them all back to the same clock. So what I want you to do is go to your Mr. and Mrs. Pharmacist and say, here are, and what we've done is that we decided to fax prescriptions to the pharmacy directly. So make sure we have the right pharmacy. And if you change pharmacies, let us know. And because we know that about 20 to 30% of the time, people either lose their prescriptions, don't get them filled. So we send them to the pharmacy. Then you need to go to the pharmacy and make sure that you take your old pills, your new pills, and you put on the same date. So when you see me, for instance, I love to renew all your medications. You have enough for a full year, and they're all the same start and stop date. You need to make sure the pharmacist will adapt and change all your prescriptions. And once you run out of prescriptions, you got to know how many refills you have left. This automatic thing is based on a physician writing prescriptions. And so there's no automatic prescriptions. It's what the physician prescribed. Now, pharmacists have different abilities to write prescriptions, renew medications, and that's changing all the time. They'll often charge you for that service, but you want to be up to date with your medications. And I'm saying this is that we did a couple studies on this way back when, and people who rely on the pharmacist to renew their medication for them, over 50 to 80% of the time, there's something wrong. So you have to decide how this is a convenient system, but you have to be in control of the system and be part of the solution. If you can, have a family member help you with this. And if you
mhm.
don't want to take a medication, you don't feel you want to be on that medication, make sure that everybody knows, all your doctors, all your pharmacists, or one pharmacist, hopefully, and all your significant others. And let's get this right, because this is a mess right now, and we have to fix this mess. And I'm finding is that if you don't care about your health, don't care about your health. But I think most people do, and there's nothing is automatic. You want to just make sure we're on the same page. So I rant and rave about that. Let's go to the next situation. And we have actually a webinar on prescription renewals. Everybody should look at this. And maybe actually, Daniel, can you do me a favor? Can you just, or Sonia, can you go online and say, let's look at prescription renewal. That's how we find this webinar. Can you show us how to do that?
Sure.
So we go to youtube.com,
Yeah.
Dr. Curnew, if you that way, or you can get the website, drcurnewhealth.com, and push the thing to YouTube, and we can look at this over here, because this is something that I think it's important. Daniel, what's your experience when you look at the clinic and medications? You can see what a mess it is most of the time.
Yeah, I mean, a lot of the times it's the same story that you get told, Dr. Curnew. When I'm talking to patients, it's very much like it's the same, but and then they have their list on them, but they tell you it's the same, nothing has changed, and then you look at the list and it's like our list is completely different, right? So it's like if I didn't actually go through and ask, you know, we wouldn't have recognized these changes. So I think it's really
Yeah.
important we need to know exactly what you're taking, as you've emphasized, Dr. Curnew, and everyone should have a list, whether it's handwritten, something provided by the pharmacy, an app on your phone. You need to have a list in some form.
Take a picture, fill your pill
Yeah.
bottles. When you come see me, make sure have a list and bring all your pills. Let's get this right.
Yeah, exactly. And as Dr. Curnew was mentioning, we have a webinar on this. So if you notice, I went into YouTube and
Oh,
just typed in
Sonia, we actually
prescription.
don't see it on your screen. I think
Oh,
you're sharing
okay.
the one. We still see the presentation.
Okay, give me 1 second. Do you see this
Yes, we
now?
see it now. Yeah.
Okay, so I guess you didn't see the process, but essentially I went onto YouTube. I typed in Greg Curnew and typed in prescription in the search bar. So
Show us where
here's
you put prescription. Show that arrow there where you type in prescription there.
yeah. So right here, if you can see the search bar here, I typed in prescription just so I could get the webinar to pop up. And it's the first thing that pops up. So here it is, talking about prescription renewals and medications at the clinic. And I just wanted to also show one thing here. I won't play the video, but in the description here, we actually have also put timestamps of the different topics we talk about. So for example, open communication and medication errors. So if you click on that, the video will jump to that specific subtopic. So that's also helpful to know when you're watching videos.
And so if you go back to that prescription rules, we have 287 views since 2 years ago. You know what? Everybody should look at that. It's a long video. You can skip through, look at that right now. And maybe we're gonna have to change our policy if right now we've been very kind to spend a couple hours on a regular basis most days renewing prescriptions. We may have to stop that service because people are not part of their healthcare solution. They're part of the problem. So this is something that I hope everybody will take a look at. You have to go back and look at that. Yeah, we'll make a shorter version, but you know what? This is something. These are your medications, and I'll say that most people got it wrong.
Yeah, and we also have a few other resources. For example, a video made, managing side effects from prescriptions. Also, one about working with your pharmacist. A lot of different resources on medications as well. So make sure you check those out.
If you can't afford the medication, let us know. There are often many options. Some of these medications are ridiculously priced, and some are really inexpensive. So there's different ways of doing this many times. Not always, but we can look at that. And don't be afraid to talk about cost. Very important.
Exactly.
Thank you for showing us.
Of course. And that brings us nicely here. We've highlighted some other videos we wanted for you to bookmark for the holiday season, especially. So the first one is on resilience, so how to stay on track with your New Year's resolution, and also just to, build resilience in general over the holiday season. Of course, it's a very joyous time for a lot of people, but also it's a difficult time because you're reflecting on the year, and maybe, you didn't get to some of the health goals you wanted, or maybe you've got new things you want to work on for the new year. So really kind of reflecting on that and thinking about your health and well-being and how we can support you best in that as well. We have a webinar that we had on healthy eating during the holidays. So of course, lots of dinners and such coming towards everyone's way. So how to manage that. And then another one on the science of feeling good. So understanding sort of happy hormones. And again, this goes back to my comment about kind of managing your emotions, regardless of how you're feeling over the holiday season and as the new year starts to approach shortly. And then we've also have a webinar on drinking and alcohol consumption, and really how to manage sort of your alcohol intake, especially during the holiday season, and how it really impacts your risk for heart disease in the future.
So actually, if you just backtrack a little bit, there is that one of the things that for some people it's a difficult time of the year. For my mom, it was always a very sad time. A lot of bad memories took place. For me, it's a very happy time. But one of the things is that you can either stay miserable or do something different. And I'll just tell you that Dia and Hannah are two experts in the matter, and they've actually helped me feel better about life, and they can help you too as well. So we had the Wednesday sessions, but they had these webinars. Now, the other thing too is science changes, and one of the things, the current recommendation is that amount of alcohol that's recommended per week is 0 to 2 per week, not per day, per week. And take a look at why. So take a look and see why science has changed. And I don't like that information, but that's the information that we have. This is a fact. So facts change, and we adapt to that. Tell us more.
Exactly. And of course, as we go deeper into the winter, it can get really hard to go outside on our daily walks, for example, that some of you might be doing, or just to get some fresh air and to really move your body and exercise. And so we have some wonderful resources created by the Exercise Club, very at-home workouts that you can do. So the first one is a 15-minute workout video. They're all chair exercises, so all you need is a chair. And the second video, of course, we have is some warm-up and cool-down stretches for you to follow along. And you can pause them, and there's timers set up and everything is included. So if you're looking for a motivation sign to start exercising, this is your sign. And we've got a lot of support, and our Exercise Club does a wonderful job at preparing these resources for you, so hopefully you take advantage of them. And this is the lab results video I wanted to highlight. So we mentioned before, accessing your results through Life Labs or DynaCare, both are possible. So we have a video on Life Labs and DynaCare as well. Both are 10 minutes long, and we walk you through the entire process from creating your account to actually opening your file, and even on how to book your blood work appointments if you wanted to have a more faster and efficient way of getting your blood work done. So another great video for you to check out. And another thing that we touched on just a few months ago, this is a webinar that I did along with another volunteer, Anya, was on the process of organ donation. So, we're thinking about the holiday season, and, I've done a lot of advocacy about organ donation for the past few years, as well as, now in medical school, learning about it too, with just recently learning about kidney transplants. This is a gift of life that you can give. We talk about both living donors, deceased donors, the process of signing up, as well as a lot of the myths and misconceptions that folks might have around organ donation. So, I really think this is a topic that's not talked about enough within our communities, within our loved ones. This is a conversation that is really important to have. At some point, with your loved ones. And really, it's something that is worthwhile to consider and learn about the impact that organ donation can have. And although we might shy away from this conversation, we really break it down for you in a really friendly and safe way. And of course, if anyone has any questions about that, you're welcome to ask Dr. Curnew or any of the volunteers that are at the clinic. So be sure to check that out as well.
You know, I remember when you gave that presentation, I said I was gonna go to that and signed up. I didn't do it, so I'm procrastinating. I gotta stop this. So one of my resolutions is that make sure then by Christmas Day that I signed in, and
Yeah.
basically when I'm done with my body, anybody can have it. A lot of used parts, some are still good, some are not. You know, is that we all should think about this. I hope at some
Mhm.
point in time Canada will change its policy, and the
Mhm.
policy will be to donate. And if you don't want to donate, you have to stop people from taking that. 'Cause I think most people want to, but most people like myself
Mhm.
procrastinate. I'm guilty as charged. I haven't. I once checked off those things in the driver's license, but it doesn't give you
Yeah.
anything done. So thank you for
Yeah.
reminding us, and we should do it.
Yeah, absolutely. And you bring up a great point, Dr. Curnew. You're definitely not the only one who's who's experienced that. The stats show that a lot of people are ready to donate, are willing to donate, but many have not signed up. So we really walk you through how to do that in this process. And yeah, a lot of provinces are trying different ways, the opt-in versus opt-out. So we also touch on that as well in the webinar. And I'll pass it over to Daniel to talk about some clinic reminders and menu.
Thanks, Sonia. Yeah, I guess before we wrap things up, there's a few general reminders we want to, share with everyone about clinic appointments, particularly the phone call appointments that we do at Dr. Curnew's. A lot of the time, or basically almost every time, prior to your phone call appointment with Dr. Curnew, you will be called by a student. And oftentimes, this may show up as an unknown call or an unknown caller ID on your phone, on your cell phone, or on your landline. Don't be alarmed. That's most likely a student, but we want to make sure that everyone is aware of this because oftentimes we as students, we try and call the patients beforehand, and unfortunately, uh, we can't get a hold of you, whether it's because you may think that, it's an unknown caller, I'm not sure who it is, I'm not going to pick up. But it's just really important to recognize that us students, we might be showing up as an unknown caller ID. Another thing that we wanted to emphasize was uh, as part of these, cell phone appointments, as I mentioned, students will call beforehand and then Dr. Curnew will call afterwards. Oftentimes, Dr. Curnew's calling from his personal cell phone, but do not call back Dr. Curnew's cell number. Oftentimes he's, on the phone with another patient or he might not be available. It's his personal cell phone number, and if you do need assistance, you should call the office. We've put that number there at the bottom. It's 905 667 0783. So if you do need any assistance, you can call the office rather than Dr. Curnew's personal cell phone. And then finally, in terms of, people sometimes ask, when is it best to, call the clinic? When is it most convenient, or when am I most likely not going to go to answering machine? And the best time to give our clinic a call is typically around 11 to 5. Usually Mondays are actually the busiest day, so try not to, call our front office on Mondays. And oftentimes between 9 and 11 in the morning as well is quite busy. So the optimal time to give our clinic a call is between 11 and 5.
And we often have two people at the front desk, except for during the lunch hour. There's always somebody, but we really spent a lot of effort trying to man that. It's very labor intensive. We want you to be available to contact us. And so I think these tests will make life easier for you. Jen, Steph are working very hard, especially during these times. As you know, the healthcare system is in big trouble. It's overwhelmed, and we need to figure out what to work with. So, unfortunately, the way things are right now is that I give myself the permission to deviate take care of the most important things at that moment in time. So I don't make apologies for if your appointment is at 10 o'clock. Rarely you're going to get a call at 10 o'clock. You might get a call from our students, and that usually will be a masked number. I will call when I can, and I'm sorry about that. And because if there's an emergency, I want to be able to take care of that. This healthcare system is falling into crisis. Um, I usually start my day at 7 in the morning, and often 9 o'clock, I'm still not finished. And that's just the way things are right now. Happy to work at this point in time, but I think people can appreciate when the repair person comes to your home, they give you a range, and that's the best we can do right now. And I'm sorry, if I could change the clinic and saying that we'll be precise, that means there'll be no deviation. And but I know for many people, they have to cancel, change. Healthcare system is having trouble adapting to everything, and we'll do the best we can. And I feel very proud of our clinic, all our staff, our volunteers, and all your patients, because we're trying to provide you comprehensive system. And some people need a lot of time, some people a little bit of time. So we try to be as flexible as we can. And the office is always there for availability. So I hope that makes it easier for you. I hope you can understand that. In the meantime, when you're waiting for an appointment, what should you do? Well, you go to YouTube. You got over 350 videos to look at, and you can start off with the prescription renewals, how to get your lab results, how to interpret your lab, what's in the blood. There's so many things, and this information is good. Some of it's long, some of it's short, and you can decide how much to put into your health. I'm curious, I'm learning, and I'd like to share that with you. So I'll be quiet a little bit. Tell us more.
Yeah. And then another thing, if you go to the next slide, one thing we want to share with all of you is that starting next month, so in December, we'll be testing and sort of incorporating these virtual visits into our clinic. So right now we have the in-person visits and the phone call visits, but we're hoping to incorporate these virtual visits. So it'll be a video call similar to Zoom, but using a secure sort of video conference software called Medio. Uh, Essentially, this is the same software actually. If we've sent you blood work requisitions in the past, you probably have a Medio account. It's the same software or same sort of similar background portal. But I've highlighted some instructions here. So for when we eventually incorporate these virtual visits into our routine, how to actually access your virtual visit with Dr. Curnew, you'll be sent an email, or you'll send an email with a link by the Medio portal, and you can click that link. It'll prompt you to log into that online portal. If you don't have an account, you'll have to create one, but you probably have, if you've received blood work, as I mentioned from us in the past, you probably have an account already. Before you enter the virtual visit waiting room, you'll want to ensure that your video and audio are working. There should be an option in the Medio software to test your audio and video, but you want to confirm that those are working so we can have the visit, smooth sailing. And then finally, once you're in the waiting room, you wait, and Dr. Curnew will sort of see you as soon as he can.
So it's kind of interesting. This is actually mandated by the Ontario government. And I think this is something that's actually important. So the 3 ways of seeing you is by phone, in person, or video conferencing. The Ontario government rightly has said there's been too many phone calls, not enough patient visits, not enough patient contact. So this is going to be a paradigm shift for everybody. It's going to be a learning phenomenon. So once you're on Medio, you have 1 hour from the time of starting to ending. So we're going to have our whole team. I'm a computer nerd, learning more about computers thanks to people like Daniel and Sonia and so many others, and I've become better at it, but I still have a lot to learn, and I know you too as well. So you have to have an email, you have to have a camera, you have to either do through your cell phone or your laptop or desktop computer. Let's try to figure this out, and we'll put some learning modules, and we'll do actually a webinar on just how to use Medio, and we'll see how that does. Obviously, need to have adequate bandwidth. We live in an area that we do have Bell fiber, but it's not reliable, and at times our computer system crashes like everywhere else. Out in the country where I live, we have Bell again. We tried other different things. Some things they just don't work, and so we're going to learn how to do this right now. So we're all at the mercy of technology, which is good, it's bad, but but also makes a huge difference. I learned so much through technology and become a smarter person. I'm sure you will too as well. So let's enjoy the challenge.
Exactly. Well said, Dr. Curnew, and thanks so much, Daniel, for sharing those clinic updates. So, as Dr. Curnew just mentioned, a lot of what we went over today, might seem daunting or overwhelming, but we're really trying to do our best to help you reach your health goals. And the whole point of all of this is, never stop learning because there is always more to learn, and life never stops teaching us. So, I hope we all go back and reflect and take a growth mindset in terms of some of the things that we talked about today. And really, again, use the resources we have, the videos, the webinars, ask questions, be curious, and really try to take your health into your own hands because at the end of the day, that's what's going to serve you the best. And with that, we've kind of ended our chat for today. If you have any questions, feel free to email us, but I'll pass it on to Daniel and Dr. Curnew for some final words.
Well, first of all, thank you for some of those highlights and encouragement. Um, is that I can feed you fish or I can teach you how to fish. And I would rather do a little bit of both because during your visits, I have to process a lot of information and try to give the right diagnosis at the right time. It is very hard to take all the variables you as a person or a patient has and come out and explain everything. I'm learning to fly a plane glider, and if you're looking at the cockpit of a plane, there's lots of controls. And if you ask the pilot, "How do you fly this plane?" He or she can give you some ideas. But learning to fly a plane glider takes years. I have 40 years of knowledge that I would love to share with you the best I can. And all I can tell you is that I love talking, learning, and sharing. I hope you will take the time to learn and to be healthier. One of the things is that when I first started practice, is that out of 10 patients with heart disease, 8 would die from their heart disease. Now, what happens is 10 people with heart disease, 3 die from their heart disease, 8 die from cancer. And the leading cause of death now is congestive heart failure in the practice I see. Um, you're at your peak fitness at around 20 to 30, then your body decays over time. You have to decide how quickly you want your body to decay and how you give that a boost right now. And certainly being healthy is not by chance, it's by basically taking steps to improve your health. First step here is a commitment on yourself. Number 2 is the adequate knowledge. And number 3 is learning and trying and feeling comfortable, not being successful and getting better at this. We all can get better. And technology is just one of those areas that can make us better or worse. And success is basically 80% hard work for most of us. There's some luck involved, but hard work is the key. And if you don't want to learn about your health, that's okay. But you know what? I think it's a big mistake, and understanding and being healthy takes a lot of work. And somehow we've gotten away from working hard on our health and just relying on others or taking chances. You don't have to. You get the information, you can make some changes and enjoy the changes. Some will be easy, some will be hard. But you know what? It's better to fire at all cylinders. If you're not interested in your health, let me know. If you're interested in your health, let me know too as well. Um, I sometimes I know I push things to extreme, and I want the best for everybody around me. And sometimes I press too hard, but I also feel that I see many people um, are just taking too many chances with their health, and it doesn't have to be. So thank you so much. Daniel, what's your final thoughts?
Mm, I know what you just said about some people take chances with their health, but it doesn't have to be that case. And it's not always too late to change either. I think with the holiday season, hopefully a lot of us will have some more time. And I would think with that time, we can spend that, watching the YouTube videos, educating ourselves about our health, putting in sort of that work and that effort and taking one step forward into, learning more about our health and yeah, like just improving ourselves on that health journey, essentially. I think with the more time that we have with the holiday season, I hope.
And learn with others, be part of a team. I'm impressed that elite athletes, people of successful enterprises, it's a team approach. And so build yourself a health team, use the right information. Is everything I tell you true? Well, this is the best I have, and with the best as I can with as much science and practicalities, hopefully a little sense of humor at times. And I realize it's hard, but you know what? It's better to go down far in all cylinders, and the ability to move forwards and to be grateful is important. Right now, the world is in a funny place right now. We become very self-centered. We're all about us, not everybody, but right now is acts of kindness, acts of gratitude. So one message is to just be nice, and do other acts of kindness to other people as well. You just mentioned our book. You actually showed us, Sonia. I'm very proud of the book we wrote. 30 Days to Healthier You, or the 130 Days to Healthier You. It's basically read the book 10 times and keep trying to get better each time.
Mhm.
The book has raised over $10,000. All the money has gone to charity. And we'll continue to do that at this stage. So we're very grateful for that. This book is 25 years of work by probably over 500 people. And I hope people enjoy it. The website is, this is our second goal. Thank you for doing the first one. And, we had some technology problems and some viruses that we were attacked and that got destroyed, but we get up and do it again. If you look at our earlier videos compared to now, I think we're getting better at it. We're having
Mhm.
fun, we're learning, and learn what's us. So step one is just get ready. Step two is learn more. And step three, fail big and fail often and get better and move forwards. And let's have some fun. Let's get healthier. Good night, everybody.
Night, everyone.